In the interest of time, I am going to go ahead and kick us off today. Good morning, good afternoon, and good evening to all of you who are just joining us. For those of you who don't know me, my name is Sarah Webb, and I'm a Senior Technical Officer at the Reproductive Health Supplies Coalition, where I get to support our work in menstrual health and backstop our menstrual health supplies workstream. We are incredibly excited to welcome you today to part 2 of our joint learning series with the Africa Coalition for Menstrual Health Management. And this particular webinar, the second in our 3-part series, will focus on leveraging data for market development. We can go to the next slide. So today we'll hear from a variety of different speakers representing HYSTRA, the Sanitation and Hygiene Fund, MHAI, the Reproductive Health Supplies Coalition, and Rising Outcomes, where we'll hear different ways that people have used data to make the case for market development in menstrual health. Next slide. A couple of quick logistics before we get started. For those of you who would like to follow along in another language, we have an AI software called Wordly, where you can use Wordly to access simultaneous translation into over 50 languages. So if you click the link that I just put in the chat, or if you have Wordly installed on your computer, you can use the app that I also shared in the chat. And once you enter that link, you'll be able to select the language that you would like to follow along in. If you have any issues with Wordly throughout the webinar, feel free to send a note to me in the chat and I can help you troubleshoot. Otherwise, you can just post a comment in the chat and somebody from our team will try to help you out. Throughout the webinar today, we'll have a couple of different ways to engage with our different panelists. You are most welcome to use the chat. You can use that for questions. You can use that to make connections with other people who are in the webinar, or to post who you are, where you're calling in from. And then we also have the Q&A box that you can use. So if you would like to use the kind of more formal Q&A box, we will have the chance to refer some of those questions to our speakers live on the call. And questions that we don't get to, our speakers will respond to in the chat box or after the webinar if we run out of time. Next slide, please. And so without further ado, I'm incredibly excited to welcome Tanya Mahajan, who will deliver our opening remarks. Tanya is the co-founder of Menstrual Health Action for Impact and the co-chair of RHSC's Menstrual Health Supplies Workstream. She has over 14 years of experience in addressing systemic barriers to markets related to health products and services. She has also worked extensively at the intersection of research, programs, and advocacy for menstrual health in India and globally. Tanya, over to you.
Thanks, Sarah, and good morning, good afternoon, good evening to everyone attending with us today. I think just to set the context for today's webinar, what are markets? Markets are basically where buyers and sellers exchange goods and services. And in this particular case, we are looking at menstrual products being available to everyone equitably and sustainably. And market failure occurs when the resultant distribution of products or access to products is inefficient, inequitable, and unsustainable. And addressing these market failures requires us to understand all of the factors that are at play, both from the demand side, the supply side, and within the enabling environment. And data, different types of data can help play an important role in understanding this, understanding where the market failures are really happening and what investments are needed to address them. So today's webinar is going to take a deep dive into different types of data sources, methodologies, and contexts and examples where data can be used to understand some of these market failures and guide programs and policies related to market building for equitable and sustainable access to menstrual products. And without any further ado, I will pass it back to Sarah for our first presentation on a key piece of data that RHSC has been generating for many years and has included menstrual products in it for the last 2 iterations. Sarah, back to you.
Thank you so much, Tanya. We can go to the next slide on delay. And we can go to the next one. Thank you so much. So for those of you who are not familiar with RHSC's LEAP report, the LEAP report, it stands for the Landscape and Projection of Reproductive Health Supplies, and it's organized across the different reproductive health areas that RHSC focuses on. So that includes contraceptives and family planning, menstrual health, abortion and post-abortion care, and maternal health. And the purpose of the report is twofold. So it first provides an overview of the current use and the current cost of menstrual products. And that is broken down in different ways. It's broken down by country, you can look by region, you can compare across the different GNI categories, and you can also look at different trends within different menstrual products. And then the second purpose is really to look at future use and cost of menstrual products. So looking ahead to 2035, what we anticipate the future use and cost being based on modeling of current trends, current population growth, and other factors. And in looking ahead to 2035, there are three different scenarios that we look at. One is maintaining current product use. So that keeps that same set of trends in product use that we see today, and really only accounts for population growth. So looking between now and 2035, how many menstrual products would we need, and what would the cost of those products be if the trends in use remained the same and we only accounted for population growth? The second scenario looks at an increase in single-use products. So it assumes that more and more people have access to single-use products, and that more and more people are buying those products, and looks at what we would need in terms of volume as well as the cost of those products in 2035. And then in the third and final scenario, we look at a shift to reusable products. So we look at more users starting to adopt reusable products. And then similarly, we quantify how many people we think would be using those products and what those costs would be. And the purpose of this report, the kind of reason for doing this, is to inform advocacy efforts. So to really have data that we can use to advocate for increased funding for menstrual health and menstrual health product access. It is to inform supply planning, so to support different country governments, different NGOs, different stakeholders in trying to meet the needs of menstruators within their countries or their regions. And then it's also to create some different theories around what we might see in terms of volumes, and how we might be able to have an impact both on menstrual product access as well as on things like climate and environment if more users were to shift to reusable products. And so I'm just going to walk through a very quick demo of the LEAP report so that people know how to access it. So Andelia, if you want to stop sharing your screen, I will share mine. And I did put the link in the chat. So if you want to follow along, if it's easier for you to learn as you go, feel free to follow that link and follow along. But essentially, when you get to the landing page for the LEAP report, you will see here the 4 different areas that are covered in the report. So if you click into menstrual health, you'll be able to see 2 different options. There's this overview report, and then there's also this global GNI comparison report. I'm going to start with the overview report and then show you a couple of other quick features. But if you just click into this background of the overview report and you scroll to the top, you'll see right now this is set to all countries. So it's looking at all low and middle income countries globally and aggregating up the analysis. So you'll see here a snapshot at globally across LMICs, there are currently an estimated 1.72 billion menstruators living in low and middle income countries. And then it proceeds to give you an estimation of product use, looking at non-purpose made products. So things like newspaper, cloth, different materials that were not necessarily intended for menstrual use. And then looking at purpose-made products, and that includes reusable products. It includes single use, and then the single use is broken into partial and full. Partial means that the user has some single-use products, but not necessarily a sufficient amount for the menstrual cycle. And full means that they have sufficient access to those single-use products. If you continue to scroll down, it will start to get into the cost. It will look at things like future use and different scenarios. We won't go into too much detail on that today, just in the interest of time. But if you have questions as you click through any of this, please feel free to reach out to me or a member of the RHSC team. And then if you wanted to look at a specific country or a specific region, you would do that up here. So where it says all countries, you would click, and then you'll see this large drop-down list of options that you have. So you can look by income groups, so all low-income countries. You could look at regions, so looking specifically at sub-Saharan Africa, or by UNDP regions, you could break it down further. And then if you continue to scroll, it gives you the option to choose by country. So you can actually get the snapshot for an individual country, both looking at the current use as well as those future use scenarios. If you click back into the menstrual health area, you'll see 2 other reports. One is this GNI comparison report. So if you, again, click into the background there, This one is just going to compare across the 3 different categories. So it will show you what's happening with low income countries. It will show you what's happening in low and middle income countries, and then upper middle income countries. So this will give you a sense of a comparison of trends across those 3 groupings. And then the other tools that we have here are a country comparison data explorer and a product deep dive explorer. And in the country comparison explorer, when you click into that, you can choose which set of countries you want to look at. So for the purpose of this conversation, I'll look at sub-Saharan Africa. It tells you kind of the list of countries that are included there. And then if you scroll down, it gives you a comparison country by country. And so it actually breaks down for each of the countries within the region that you're looking at, the number of users using single-use products, the number using reusable products, and then the numbers using non-purpose made products. And it will show you those volumes by country. And if you continue to scroll down, it will do the same thing for those future scenarios. So breaking those down by country and showing you the trends that it forecasts into the future. And then finally, if you click back into this tab, we have this product deep dive explorer. And if you click into that, this gives you a deep dive on a specific type of product. So at the top, you can see right now, this is set to reusable pads. You can also change that to single-use products or to menstrual cups. And then explore the data from that perspective. So looking at volumes of users by income group, looking at the distribution of those volumes of users globally, kind of through this more interactive map, and then looking at those future forecasted changes ahead. So please, if you have any questions as you become familiar with this tool, if you have questions about the methodology, about its use or its application, you're more than welcome to message me. I'll also put my email in the chat in just a moment. And otherwise, we hope this ends up being a helpful tool as you look at different snapshots of data. And with that, Tanya, I will hand it back over to you for our panel. And on delay, I will stop sharing my screen so that you can pull yours back up.
Great. Thank you so much, Sarah. That was very helpful. I think LEAP is a great resource that can be used across different contexts for building at least a basic understanding, if not a detailed one, of the market in any country, in a group of countries, in a region, etc. And I urge our participants to really go and try it out for themselves today. We have a very interesting panel today with us where our speakers have actually applied different data sources to build the case for understanding or understood different aspects of the market using different types of data sources, and particularly in the African context. First of all, we have Lucy Wilson with us today. Lucy Wilson is an independent consultant in sexual and reproductive health and rights, including menstrual health. And she does monitoring and evaluation, communication, strategic planning, writing, and much, much more, as we know from the work stream. Welcome, Lucy. We also have with us Jen Sharbi. Jen is a project manager and menstrual health lead at Hystra, a strategic consultancy focused on inclusive businesses. Welcome, Jen. We also have with us Sophia Grinwalds, who is a global expert on menstrual health and the co-founder of AfriPads, a leading menstrual health company and manufacturer of reusable sanitary pads. Sophia is now the menstrual health country market specialist at the Sanitation and Hygiene Fund, where she's leading market-based approaches to menstrual health that will transform access to safe, quality, and affordable menstrual solutions. So with that, I welcome all of our speakers and give the floor to you guys to introduce the case studies that you are going to present to us today to see how you have used different types of data sources. And we'll follow that up with a question and answer round with all of you.
And Lucy, I believe your slides are first, so we'll hand the floor to you. And Adile, we can go to the next slide.
Thanks, everyone. I'm honored to be here today talking about menstrual health market data. I'm going to focus on a piece of work that I did in 2020 with RHSC, but draw on some lessons learned and particular resources available that I've picked up from other menstrual health market research over the past couple of years. So in 2020, RHSC commissioned Man Global Health to undertake an assessment to landscape supply side factors to menstrual health product access in Africa and South Asia. The team working on that assessment included several regular RHSC menstrual health supply workstream members, including Tanya, of course, as well as Halima Lila and Jennifer Amati. And I see Nayantara Watsa, who's on the webinar today, who is also part of that team. Our objective was to assess market constraints and identify opportunities to increase access to menstrual products in Africa and Asia. And a big part of that request was to map the various supply chains for how products get from manufacturers and brand owners to consumers within a country. And so that's the image that you see on the slide here. There's also a link to the report, and I'll try to drop that into the chat as well if you want to see. Oh, thank you, Sarah, for already putting it in there. Great, so we can go to the next slide. So thinking about the data that we collected and used for the supply side assessment, we did a lot of key informant interviews. Some of these were with global stakeholders who we expected to have a good general sense of the market, but we also interviewed market actors along the supply chain in the focus countries to build that greater understanding of how products were reaching consumers and what the challenges and opportunities were along the supply chain. So this included brand owners, manufacturers, importers and wholesalers, distributors, and retailers. And sometimes this meant identifying the next informant to interview on a rolling basis by asking, who else should we talk to? Or who do you get your products from? The teams in the focus countries also did some light, and it was pretty light, this could be much more in-depth, retail assessments in which they identified the types of shops, stalls, or even e-commerce sites that were selling menstrual products, the types and the brands being sold, and the prices that were seen. We also use existing or secondary data. While there isn't necessarily a whole lot of published academic literature directly addressing supply side market data, there's a lot on very related topics like product safety and acceptability, cultural considerations, effectiveness of tax reform, etc. We also pulled from the gray literature or reports and other documents. Back in 2020, this meant some great market reports from PSI, funded by the Case for Her, several assessments that describe pilot programs offering new types of products in their communities, etc. And then we did a lot of targeted web searches. And by this, I mean looking for specific pieces of information by just searching what was out there available on the internet. So is there a standard for this country? Is there any type of policy that addresses menstrual health? What more can I learn about this brand that seems to be a major player in the country? What other actors in the country could be involved in this work? Any of these type of questions where we were really just looking to answer a specific question by digging around on the web. Finally, of course, the LEAP data was really, really instrumental. I just can't emphasize enough how often and how much I've used the LEAP data in various reports. And we occasionally supplemented and compared that with some of the freely available data that we could get from Euromonitor, which is one of the paid market research report producers. That, in a nutshell, is the type of data that we used in that report. So that's all from me. I'll hand back to you, Tanya, or maybe over to Jen, and say next slide.
Thanks, Lucy. Yes, that's Jen next now.
Great. Hello, everyone. And thanks a lot for giving me the opportunity to share a bit Hystra's experience while working in the menstrual health sector. I must say that I'm relatively new to the menstrual health sector. I started working in menstrual health about 3 years ago for a report that was funded by the Bill and Melinda Gates Foundation on finding opportunities to develop market-based approach for menstrual health products. And so as part of Hystra, as mentioned, which is a strategic consultancy that it works in a wide range of sectors, from nutrition to clean energy to health. This was the first time we were working in menstrual health. And one realization that we made is that compared to other sectors, indeed, data is very scarce. So while doing this beginning of research, we tried to understand what were the resources available for us to build a business case for menstrual health products and market-based approach. So I've listed on the left the resources that we found the most useful to us. I won't go into much detail about LEAP. I think Sarah explained that very well. I think for us, the most useful information was One, the number of menstruators in a consolidated way. So we knew for all the countries, which was the number currently, but also in terms of projected in the future. So that was something very useful. And the second thing that we couldn't find elsewhere was the penetration of disposable or single use, as you call them, products. So out of the total number of menstruators, how many are currently using single use products in the markets? Maybe one small caveat when using this type of data is that it's really great because it consolidates different sources from different countries, but also because it has to represent all the countries. Sometimes it uses some averages. So for instance, for the prices, you will have regional averages. And as much as possible, this is a great starting point. But if you have more in-depth understanding of a specific country you want to focus on, it's usually helpful to also cross-check and have more national data to compare with. The second data source that was particularly useful for us, but specifically on the disposable market, are market reports. As Lucy mentioned, these are usually paid reports, and we had the opportunity to trial this for a few countries through our reports. And I must say that we have tried different type of providers with different prices. And what was quite interesting is that the different data from the different providers were quite different. So in the end, it turned out that Euromonitor seemed to be the most reliable source in terms of estimates of the market size of disposable markets, and it's also the provider with the highest number of countries. Unfortunately, it's still a very limited number of countries where there are specific data, particularly the poorest country where the market are the most nascent. There is no reports, but this is the one where we have had the most data from. Big caveats again on this data source is that unfortunately the data is extremely costly. It can go up to $1,000 for one report for one country. So you have to have quite a big research and funding to be able to access such type of data. And also this data is confidential, so you cannot share per se, unfortunately, the data to the wider world because you have to pay for it, then you have to keep it confidential. So it requires, doing some order of magnitude or things like that when manipulating such data source. Unfortunately, these types of market reports are not, for now at least, integrating reusable products in their estimates. So you really have to find alternative ways to estimate this size of the markets. So one option is to run some interviews with the key players of the sector. And what I found quite unique in the menstrual health space is really the openness of most players to share their knowledge and data with us. As there is a strong understanding that it is only by building an overall market that individual companies will thrive. But nevertheless, just take this opportunity to thank everyone that have been annoying with all my questions over the years for being so open and with the data that has been shared over the past years. Again, same mention as with Euromonitor, because of the confidentiality, you have to be careful of how you manipulate this data. And finally, the last source that we had to rely on are primary data collection, especially when you are looking at customer preferences for different types of products. And again, this can be costly, time-consuming, but this really turned out to be invaluable to us. And I'll come back to that when I'll talk about examples of how we've leveraged this data. But it helps us really build a case for the potential for reusable products. So in some cases, it's really worth doing this primary data collection. The last source is from the World Bank. This is more generic data, of course, on inflation rate, GDP growth, but it can also be very useful when you try to project market size in the future. So, of course, I encourage you to read the full reports that we have written on the topic, but I've put two concrete examples of how we've leveraged the different sources to build a business case. The first one is showing the potential for reusable products in low and middle income countries. So we started very broad with the number of menstruators in the global south. As you saw, it's very easy from the leap to get this data. We then took out the poorest wealth quintile because we assumed that this menstruator would be the less able to pay for the reusable products, and that's how we arrived to the 1.3 billion. And then we looked at the menstruators that would be either willing or able or willing and able to pay for reusable menstrual products. And for this, we leveraged the primary data collection that I was just mentioning, and that was done with our partner Bopink, that's help us determine that when we were offering choice to menstruators and informing about different products and their prices, 60% of menstruators' first choice went to reusable products. So this is how we've managed to say, okay, out of the 1.7 billion, there might be a potential for 1 billion menstruators that could be interested in reusable products. Again, we subtracted the poorest wealth quintile to arrive to these estimates. I think this is as you can see, it's very high level estimates, and of course that will need to be refined in the coming year. But we believe it was still a useful exercise to really show the potential for the reusable markets and encourage more investment to be done in such area. I think I have run out of time, so I'll switch. Won't talk over the next example, but feel free to ask any question. I'll be happy to answer.
Thanks, Jen. That was really great, and both Lucy's and your examples have, I think, given a spectrum of data sources that can be used for both the supply side, overall market size, and understanding consumer demand, willingness to pay, etc. And we move now to Sonia, who will talk about the market maturity framework, which brings together all of these different data points. Over to you, Sonia.
Great, thanks, Tanya. So I'm going to share about an assessment tool that SHF has recently developed. And contrary to the research that was shared in the reports produced by Lucy and Jean, which were already completed, the MHMAT has recently been developed. And so we've developed the theoretical structure, but we have a lot to learn in the actual application. So I'll walk through a little bit of the process so far. Maybe just to start with the framing is, why are we assessing the maturity of menstrual health markets, and what does understanding market maturity actually tell us? We know that when we talk about market-based approaches, that we need a well-functioning and competitive menstrual health market in order to increase access to menstrual products. And the reality is, of course, that these markets are falling short. So really, there's an opportunity to leverage data and to use that to inform market-based approaches to develop these markets further. But to do this, we need to frame and really understand what a developed or mature menstrual health market looks like compared to a moderately developed menstrual health market or a nascent market. So to get these insights into the pathway, we need to then understand what can we learn by assessing market maturity. And really that helps us to know the current level of MH market functioning, to assess how well the needs and the preferences of consumers are being met. Understanding market maturity also helps us understand and identify what are the market barriers, what are the risks and the opportunities that we can capitalize on. And using that information, we can inform stakeholder decisions and prioritize interventions that can actually then help to strengthen the MH market. So overall, we see a lot of benefits in really understanding what the market maturity levels are in a country. And so while these tools exist and they've been developed in other markets and for other commodities, for example, in sanitation or in family planning, there's no tool or methodology that already existed for menstrual health markets. And we know that without a common approach, market development approaches either don't happen, they can be scattered or uncoordinated, and they can fail to develop the market effectively and sustainably. So if we can move to the next slide, SHF has developed what it's calling the MHMAT, which is the Menstrual Health Market Maturity Assessment Tool. And the objective of the tool is to provide that common methodology, a way to systematically measure, assess, and really compare the state of an MH market at country level by applying a set of indicators. And the key outputs of the tool will be a set of information that is common about the market and about those barriers, which stakeholders can then use to make data-driven decisions regarding market building interventions, about funding, about financing, and investment in the markets. Now, the backbone of this tool is based on 5 key pillars to assess the maturity of the market. Now, 2 of these pillars look at the MH market. So they're looking at supply and demand. The other 3 pillars are looking at the enabling environment that the MH market operates in. So we're looking at what is the policy and regulatory environment, what is the business enabling environment to support the private sector and MH enterprises, and then what is the financial sector environment? So what is the availability of financing and funding that's needed to support this market to develop? The next step was to develop and identify several sub-pillars within each pillar. And so for each pillar, we have identified 3 to 4 sub-pillars, which you can see outlined in the graphic on the slide. And then in total, we went and identified 100 indicators that were selected to assess the market and its maturity levels at sub-pillar level. So each of those sub-pillars has a range between as few as 12 to as many as 18 indicators that are used to then provide an assessment of the market maturity. Now, when it comes to actually assessing market maturity, that assessment is done at pillar and sub-pillar level and will be visually demonstrated through radar graphs and likely through something like a heat map. There won't be aggregate scoring of an overall level of maturity of a country. So what are some of the key features? I think it's important to share that this has really been developed as a public good. It's an open source tool, one that can be used by any stakeholders who is interested in implementing and understanding the market. And for those who aren't capable or don't have the resources to do the implementation, the data that's collected will be shared publicly. So when SHF implements the tool itself, that data will be shared, and then any other implementer who shares the data with SHF will also be shared and made publicly available in order to really increase the available market data on MH markets. Now, when we look at the data requirements for the tool, we have over 100 indicators. And as my colleagues have mentioned, there's really this tremendous lack of MH data. And so that's been a considerable barrier as we've actually developed this tool and selected the indicators to support it. Now, we have identified primary and secondary data sources that are going to be needed to populate our indicators. Now, when it comes to the primary data sources, again, as mentioned by my colleagues, what exists or what will be used are really key informant interviews, surveys. These will be targeted at menstrual health enterprises, and then actual retail market assessments. So really looking at the shops and doing scans of what's available on the markets. In terms of secondary data, we have sources that are global data sets. That's anything that has been mentioned before, including the World Bank and the LEAP reports, among others. We also will be using MH market reports. Lucy mentioned Euromonitor and other providers exist. Of course, this is paid data, which is a barrier. And then, of course, the literature reviews of existing publications and looking at targeted online sources in order to populate remaining indicators. Now, we believe that there's approximately 70% of the indicators in the MHMAT can be populated through secondary data sources, whereas at least 30 will require primary data collection. But what we know is that at country level, data availability will vary tremendously. And so these, let's say these ratios of how we see the data sources for the indicators will really, these are estimates, and that will really be influenced by country level data. And so this will be a challenge. Just to wrap up, next steps of the tool are piloting. So SHF will be piloting the tool in the coming months. And the key objectives are to really confirm the viability of collecting the data for each indicator, further refinements of the data sources and the collection methodologies, identifying the estimated costs and resources to implement the tool, which of course will give us insights into the overall feasibility of implementation. So we're looking forward to sharing this information with you, and we're also seeking partners for anyone who might be interested in collaborating on implementation. Back to you, Tanya.
Thank you so much, Sonia. That's, I mean, really looking forward to the application of the tool and seeing, how the indicators pan out and where some of the challenges are, but also where you actually see data available where you may have anticipated challenges. So really looking forward to understanding that better. So just going into a few questions based on all of the case examples you shared, Lucy and Jen, had a question for you. Both of you shared excellent examples of how you have used different types of data sources, a great mix of secondary, primary, quantitative, qualitative, data sources to build an understanding of the market. What are some of the practical tips that you would have for us while leveraging market data? And Lucy, maybe we can start with you.
Thanks. It's a great question, and I think there's a couple of tips that I would bring forward to the group. I think first and maybe most importantly is to get as close to the source and on the ground as possible to really understand what the context is. The more primary data collection, in some ways, the better, even though, as Sonia just said, it's super expensive and can be hard. You really learn a lot from talking to people who are there and who really understand the local markets. Then in doing the literature reviews and web searches, the need to really be creative and persistent, I think, is something that I've learned. I can feel like I've done everything that I can to find anything on menstrual health in a particular country, and then watch somebody come along behind me and find 3 or 4 more resources. And sometimes that's things like language, like maybe my Google is really set to find the menu for the local restaurant in my town in English, while, somebody who's in the region who's speaking the language of that country can really get a better set of responses and resources coming out of the searching that he or she is doing. And I think those 2 first tips really reflect my challenge of doing market research in Africa while I'm sitting in the United States. It's not ideal. It's not really possible. And I wouldn't be able to even be a part of this without the team members that I've had on the ground in the countries in the region who have really been leading a lot of the actual data collection. So having people who are there is really, really essential.
Thanks, Lucy. That's a great point. I think there's absolute value in having partners, collaborators in countries that we are actually looking to collect data from. Jen, what about you? Do you have some practical tips for us?
Yes, I align with what Lucy was sharing. Maybe one thing that I found the most important when we were doing our research is to triangulate data and really cross-check, because as we mentioned previously, most of the data sources rely on quite small sample of data. So it might be, correct in one region, but not correct at the national level. So being able to use different sources and make averages in between sources is very important. So for instance, LEAP, it wasn't the case when we were doing the report, has now an estimate of the number of menstruators using reusable products. That's a great source, but it's also important to triangulate that with additional interviews with some key reusable market players to see if there is this corresponds, and the answer probably lies in the middle. So making sure as much as possible to get all the great data sources that you have at an international level, and consolidation is great to get a great overview. But cross-checking this with more granular data is also very important, I would say.
Absolutely, absolutely. I think Leap also pulls from a lot of different secondary sources. So I think it makes the best use of what's available. So absolutely, I think checking with on-ground references is definitely required. Lucy, you alluded to online web searches and that you've used that extensively with varying degrees of success. But would you have some examples of, say, data sources online that may not be our usual suspects for helping understand the supply side and the enabling environment sides of the market?
Yeah, and I think some of these have been mentioned today already by Sonia and by Jean. Maybe in addition, when looking for policies, really getting to know the Ministry of Health, Education, Environment, the relevant ministries that might be working on menstrual health, getting to know their websites. Local government websites are also useful for tax and import duties and to understand what might those rates might be. Sometimes the regional economic associations are also useful. That's like ECOWAS in West Africa. There's also some resources that are available to manufacturers and suppliers who are thinking of exporting their products to specific countries and to provide kind of cross-country trade data. And so those can be resources for tax and import duties. There's a company called Avalera that does a lot on VAT rates. There's a market access map that shows tariff rates. And then for standards, RHSC has a standards library that Tanya helped create several years ago. And that library will hopefully be updated soon. That's a great resource, as well as, again, the national standards boards. And then often just the websites for the brand owners or suppliers can be really useful resources.
Definitely, Lucy. Thank you. And I think one piece that I have found very useful is also annual reports of market players, which are available on their websites. It's just sort of digging deep into them to understand market size, etc. Jen, we've spoken about a lot of different data sources, but in the future, with limited money available, but requirements for investments in all types of research and data, what type of data would be useful to fill some of these crucial gaps? Where should that investment really be targeted?
Yes, and I'm afraid that even the data that we have currently might shrink in the coming years. So it's even more important to see what are the critical data. I think that, at least from our perspective, getting a better understanding of what is behind the number of menstruators that are using reusable, disposable products, and trying to understand what would be their preferences. How many products do they use? This is something that I didn't have the opportunity to mention during the presentation, but saying that there are 75% of menstruators using commercial products is not enough, because in most cases it's only very partially covering their needs. So having a better understanding of these type of data, I think, is really key to show that providing access is not sufficient. I think one important element is also to look by wealth quintiles and by age group. One of the things that we found very interesting in India, for instance, was that the usage of commercial products was quite significantly different from the youngest population to the oldest. So when you try to project things, just the status quo is not enough, and you have to take into account these type of data to understand better what the future will look like. And then maybe a final point is that while data is super useful, and because we know that the money is quite scarce, I'm strongly in favor of investing in trialing on the ground different type of tactics, supporting the companies, because this will also provide very useful data and which much more concrete actions to take out of these pilots. That's maybe a bias that I have, but a concrete action and pilot is sometimes as useful as large data collection.
Agreed, absolutely agreed. And I think donor investments in some of these private sector enterprises can generate those data points as a public good, which otherwise may not be available as a public good. So absolutely. Thank you so much for your insights. We have some questions for Sonia on the market maturity tool, the market maturity framework, which she shared about Sonia, it's a brilliant case study of bringing together different types of data sources. How do you think it will be used by different stakeholders? And what do you have in mind in terms of intended use?
Yeah, so we see a variety of use cases for the MH map. And so on this basis, it was really developed as a multi-stakeholder tool. And we really took that approach in not only designing the pillars, but also the indicators themselves. We see four target audiences or target users of the tool. The first category being the private sector, specifically MH enterprises. The second is policymakers and regulators, so government in large part. The third is really the financing and funding stakeholders. And the fourth target audience are the technical stakeholders. So that could range from NGOs to academic researchers. And so when we designed the tool, we also took into consideration that some stakeholders will have an interest in the overall maturity assessment, so looking at all 5 pillars, whereas other stakeholders will have an interest in an individual pillar or even perhaps a sub-pillar. And so, to share a few quick examples, if we were to look at the policy and regulatory enabling environment pillar, now there's an interest in that pillar from governments who are interested in understanding how is that enabling environment when it comes to standards, when it comes to taxation, in terms of enabling mental health companies to enter the market and to scale. So by understanding how that particular pillar is performing, it helps to provide a bit of a roadmap in terms of what needs to be done in terms of priority interventions. Now, similarly, a technical stakeholder could look at that same pillar and realize that there's a huge need or opportunity to advocate for standards or to advocate for technical assistance and support for the private sector to adopt standards. If we took another example of the private sector, we could see how the tool itself could help inform a decision around a country selection for where the company plans to expand, whether that's through market entry itself or through exporting its products. And then if we were to look at an investor, we could say that if you look at a comparative index, so perhaps there's the market attractiveness index for Pago Solar. Now, that tool has helped inform investors in whether or not the market is investment ready. And so if we could see a similar parallel to investors using this tool to really look at the market readiness and investment readiness of a particular country when it comes to the MH market. So a variety of use cases, not only across the stakeholders, but also across the tool itself, whether looking broadly at the whole tool or down at pillar or sub-pillar level.
Definitely. Again, looking forward to seeing how different stakeholders use and what are the use cases that we see. And so you've started with a huge number of indicators and come down to between 12 to 18 per pillar. What are some of the factors that influenced the selection of this, list of indicators that you finally ended up with?
Yeah, admittedly, it was very challenging. And one of the first questions we had to ask was, do we strictly look at indicators that we can easily populate from existing data? Or do we design the indicators that will give us the most ideal assessment of market maturity? We went for the latter simply because if we were to only focus on existing data and existing indicators, as you can garner from this discussion today, that's such a small pool of information. And so I think it's just important to recognize that this tool is, it's not a scientific approach. There will be a need to rely on indicators that are proxies. There'll be a need to rely on both quantitative and qualitative data sources, and to recognize that there is a margin of error in this process. I think the key, though, is that as we start to collect and build the data, and as we continue to have discussions like we're having today, that we hope will lead to greater development of market data, that gap will start to close a bit. But of course, some of the factors that we had to look at was or included, what is the actual ease of collecting this data? So what is the availability? What is the resource requirement? So time, money, boots on the ground in the country of work. we had to look at, how do we make sure with a multi-audience tool that we're targeting indicators that speak to all of these audiences and answer some of their key questions about market maturity. And I think also recognizing that we couldn't just focus on indicators that were specific to MH. We also had to consider indicators that are broader, whether that's inflation rates or income and purchasing power, in order to make sure that we really look at the broader market. So a handful, but of feedbacks there. But really, I'd say it's challenging, and it really has put a spotlight on how much work we have to do when it comes to building this market data.
Great. And that makes sense, because you cannot have the menstrual product market in a silo. You have to have an understanding of the wider market built in as well. That's helpful to understand, Sonia. And I think we look forward to also seeing some of this new data generated as the market maturity tool is applied to different countries. And what do you see as some benefits of using this standardized list of indicators used over time? How would that help the market and the ecosystem at large?
Yeah, absolutely. I'll be quick because I know we're running low on time, but certainly it can help us to assess the progress of menstrual health market development over time. So how do we see maturity increasing? It will help us to understand the impact and really, let's say, the interplay of specific interventions that are carried out by different stakeholders. We hope that it will help us identify trends. So, for example, can we see a link between strengthening the policy and regulatory pillar with an increase in market entry or scaling of the private sector? And similarly, do we see interplay between specific indicators, like maybe the enforcement of standards or the adoption of standards with the increase of products available on the shelf? And lastly, really just enabling comparison over countries across time. And that's with a focus really on learning, not on ranking. I think that's very important. So, we recognize that as the tool develops, we'll understand these benefits more and more, but those are some of the, let's say, priority focuses of having a standardized set of indicators.
Great. Thanks, Sonia. That's, again, very helpful. And thank you to all of our panelists, Lucy, Jen, Sonia, very interesting and important insights as we are still working collaboratively on building an understanding of this market. I'll hand back to Sarah for the next section, which is the last section of our webinar today. Back to you, Sarah. Thank you so much.
Thank you so much, Tanya. And Adila, we can go ahead and pull the slides up. So for this next section, we are going to pivot to kind of looking ahead to some data that we hope is yet to come. So we can go to the next slide, Adila. And in this next section, we will be hearing from Adrian Dongas. Adrian has extensive experience in the market-based approaches for menstrual health and hygiene. At the Sanitation and Hygiene Fund, or SHF, he leads the development and rollout of a global MHH strategy to realize the fund's vision of transforming the way that people access menstrual products through markets across low and middle income countries. And before I hand it over to Adrian, also wanted to flag that this particular focus, the role of trade data, is an area of interest for RHSD that moves beyond the menstrual health supplies workstream. So this is a really great example, I think, of the power in collective action and the way that we link the work of the menstrual health supplies workstream to the work that we do on contraceptive supplies and other supplies. And so in a moment, you'll hear from Adrian about some of the activities that we have planned for improving access to trade data. But wanted to say that this is something that RHSD is really excited to expand access to as a way of improving market data, particularly given the current times and some of the challenges that we know are coming in accessing more public funding for data collection. And so this is something that's really exciting. These conversations actually started over a year ago. An RHSD member, Maisha Neds, had elevated this idea of using trade data as a critical data point in understanding both contraceptive data as well as menstrual health supplies data. And so it's something that RHSD is excited to take on in partnership with many of our members across the coalition. And as you listen to Adrian talk, if this is something that you are interested in, feel free to reach out to me directly and we'll loop you into some of the follow-up here. So Adrian, without further ado, I will hand it over to you to tell us about some of these trade data opportunities.
Yeah, thanks so much, Sarah. And I think given the conversation that we've been hearing today, what we see is that a lot of the initiatives are relying either on existing initiatives to collect public data on markets, on usage, on product preferences. And if you go to the next slide, what you'll see is that that data is crucial. We need to understand what kind of contraceptives are used, what kind of menstrual products are used, who prefers to use what. But those efforts are really highly resource intensive. Running national surveys every couple of years, one, that frequency is very low. It requires sending survey and enumerators out everywhere. And unfortunately, these are exactly some of the programs that we see discontinued over the last couple of weeks and months. And that puts a lot of our efforts at risk. And if we don't have a baseline of the data of where we stand from a public and from a private perspective, how then can we even imagine to not only increase access, but also just make use of a market opportunity? And we know that even in the case where we are running these very elaborate national surveys, it all relies on self-reported data through questionnaires, which are very inaccurate at the best of times. So there should be a better way to do it. And I did want to flag here as well that despite leveraging some of the surveys that are out there, there's so much modeling that is still happening. There are so many of the reports that you see today, they're not exact numbers of, I got a crate of apples, I'm going to count, I have 100 apples. No, there's 5 people sitting in a room and thinking, do you think it's going to be 50 or you think it's going to be 100? So we need to move towards data that actually reflects the trends and the behaviors in the market. And market data can play a role in that. So if we move to the next slide, what you can see here is something very boring, very much paperwork reality, that it's incredibly powerful. So every product that moves across a border receives an HS code. These are unique classification codes that are used by all customs authorities around the world. They cover over 5,000 different categories. And yes, you guessed it, unfortunately, menstrual products don't have a dedicated category of its own. And actually, for some other reproductive health commodities, including contraceptives and IUDs, there's still a lot to improve. But just to give you a sense of how this works, if you're based in the Netherlands, where I'm from, we export a lot of apples, and we move those apples to the United Kingdom. Then that apple will receive both an international code, the first 6 digits, and sometimes a few additional ones. And as you look at this slide, you will see that it's broken down by a category of a food, vegetable product, a fruit, and in the end, an apple. Those first 6 digits are collected and placed into a public database called UN Comtrade, openly accessible to anyone. So you can determine not only how many apples move to the United Kingdom. If you subtract all the apples that the United Kingdom exports and you add up all the apples they import, as long as the UK doesn't grow any apples themselves, you know exactly how many apples were consumed in a single year. This is incredibly powerful data that will allow us to understand reliance on producing markets, total product use, total market size, the access gap, the total value of the market. And it's something that potentially could give us much better insight into the breakdown between different product subcategories, cups versus discs, tampons versus single-use pads, compostable maybe even. So there's a lot that we can gain here. But the reality today is that all that data, if we go to the next slide, for menstrual products is useless, because menstrual products today are grouped in a single category with other products like wipes, diapers, and other absorbent materials. So the data you receive from the public database doesn't really tell you much. And there is now an opportunity to change that. If we move to the next slide, there is an organization called the World Customs Organization. Works closely together with the WTO, and they revise every 5 years how products are categorized under this harmonized systems codes category. In 2027, these new categories will be launched, and the revision process for HS codes is going on right now. So there's a big opportunity to propose a revision. If you move to the next slide, you'll see that is actually a pretty realistic ask, because the first thing we require is we need open slots. We need to have enough space to add new categories. Thankfully, the HS codes where menstrual products are in have well over 90 free slots. There is more than enough space. But there are more compelling reasons. Right now, the International Standards Organization is developing global ISO standards for 4 subcategories of menstrual products. And these are actually the things that a customs official will need to look at. So aligning ISO standard categorization with HS code categorization will be a more efficient and better aligned process than what customs officials will be going through if we don't make the change. And the great thing is that if we were to introduce this, and it would be introduced in 2027, come, let's say, March 2028, you would instantly get data on every single country in the world for menstrual products and potentially also for contraceptives. So what are we doing? A couple of different organizations have come together. SHF with its initiative on menstrual health markets, capital M, the Reproductive Health Supplies Coalition with the Market Development Working Group, the Advocacy Working Group, but also the International Trade Center. This is a joint body of the UN and the WTO, have put together a brief and an ask to member states. The World Customs Organization works like the UN, and we're basically looking to support them to submit a request for revision of the HS codes for menstrual products and for contraceptives. So on the next slide, you'll see member states' engagement is critical. We are working towards an initial high-level event, briefing all of the trade-related missions here in Geneva. The reason being that every country in the world has a trade representation in Geneva because of the World Trade Organization. And over the next year or so, we are looking to support them in that process and make that initial ask. The responses so far have been incredibly positive because we are not asking for money. We're asking for a paperwork change in something that can make a huge difference in a lot of the programs that different countries, different donors have been supporting over time. But this is not a request that should just come from us. And this is why RHSC is so important. It is a request around data that should come from a community that requires that, whether you are a technical stakeholder, private sector, or others. So I'm just going to echo the call that Sarah made, is to please, if you think that this is important, add your name to this, write an email, let her know, yes, we would like better market data, and we think this is a good initiative to support that. More information will come from RHSC. And if you have some time left, go advocate for change with your national ministries, the people that you engage with at a national level. I'm going to stop now because we're already over time. There's a lot more information to digest. Very happy to answer more questions at a later stage, or just put the questions in an email to Sarah. Thank you so much.
Awesome. Thank you so much, Adrian. We can just go to the last slide on delay. This was an excellent conversation. Thank you all so much for joining. And a huge thank you to our panelists, to our speakers for sharing different ways that they have compiled data related to menstrual health market development, and for flagging some of the challenges that exist in those efforts to compile data. I know we're over time, so I think we'll go ahead and wrap up, but please do reach out to me, to any of our speakers today, should you have any follow-up questions. We will circulate all of the different resources that were dropped in the chat during the webinar when we send the recording. And we look forward to hopefully continuing to engage with each of you through the menstrual health supplies workstream or other work that RHSC is leading across our different implementing mechanisms. So thank you all so much, and I hope you have a great rest of the day. We'll talk to you all soon.